Yes, we are going to continue on the family planning. This is going to form our fourth module, if I'm not mistaken. And the topic we are considering is uterine devices, IUD. I still remain Dr. David Olusegun Awoleye. T-shaped object placed in the uterus to prevent pregnancy must be on period during insertion. In natural childbirth required to use IUD, extremely effective without using hormones. That is 97%. So when we talk of uterine device, we're talking of the T-shaped object that is placed or inserted inside or inserted to the uterus to prevent pregnancy. We must make sure that this insertion takes place during the period. We must make sure that insertion takes place during the period, and this is a natural birth that is required to use IUD, and we discover that the effectiveness of the copper T, that the IUD, is 97%. If you look at the diagram, you see the position of the copper T at the in the uterus. Look at it. Uterine devices are molded plastic devices. Some of it contain copper, which disrupts the normal uterine environment. So what this device does is to disrupts the normal uterine environment, and thereby preventing pregnancy from occurring. The T-shaped objects placed in the uterus to prevent pregnancy, and we said it must be on period during insertion, and thus effectiveness of greater than 97%. It means that it is very effective without using hormone. Yes, copper T and then progestisats. We are going to compare the two, copper T and versus progestisats. For copper T can spend up to 10 years when inserted to the uterus, and it has 99.2% effectiveness, while progestisats can only spend 1 year when inserted, and it has 98% effectiveness. Copper T on IUD acts as spermicide. It acts as spermicide. The IUD blocks egg from implanting, while the T-shaped plastic that releases hormones, that is progestisats, over a year time frame, and it just thickens the mucus and block eggs. It thickens the mucus and block eggs. So for copper T, we said it lasts for 10 years, and for progestisats, just 1 year. Effectiveness of copper T is 99.2%, while that of progestisats is 98%. Then we said that the plastic, that is the one that is that has progestisat, means that it has progesterone. It releases hormone, and the hormone is released is over a year frame, and what it does is to thicken the mucus and block the egg. So it blocks the egg from being released, and it thickens the mucus of the cervix, thereby preventing spermatozoa from entering into the uterus. But for copper T, it does act as spermicide, and it blocks the egg from implanting. So that is the two let's look at sterilization. Procedure performed on a man or a woman permanently sterilizes. So we are talking about the permanent sterility is just a kind of procedure that is performed. It's just a surgical procedure that is performed to man and woman to cause them to remain sterile, as in not be able to not be able to give birth or to become pregnant or to reproduce. So we have tubal ligation for the female, where the fallopian tube are tied and cut, and we have vasectomy for the male. So tubal ligation is a surgical procedure that is performed on a woman, and the fallopian tubes are cut and they're tied, and that will cause it to prevent it from accepting the eggs during ovulation, prevent egg from reaching the sperm. So once it is cut, don't forget your reproductive system. We talk about the infundibulum, the fibroid of the infundibulum picked up the egg, the matured egg from the ovary, and stays in the ampulla. But once there is tubal ligation, once the tubes are ligated and cut, then the eggs will be prevented from getting to where from reaching the sperm. Not only that, we have the failure rates, which vary by procedure, and it's from 0.8% to 3.7%. So if the procedure is not well done, then there's possibility of failure, but it varies by procedure. So it is not so when the procedure is well done, then it's permanent sterility, as the name implies. Or another thing is the person who has passed through the surgical experience might experience heavy period. So the monthly flow might be heavy if the person has undergo tubal ligation. Let's look at the procedure. Tubal ligation, surgical procedures performed on a woman. Fallopian tubes are cut, tied, cauterized, prevent eggs from reaching sperms. Failure rates, we said it varies procedure from by procedures, and it's from 0 to 0.8% to 3.7%, and the person may experience heavy or heavier period. Now, the pictorial part of it, you see the fallopian tube. Fallopian tube here, cauterization of fallopian tube takes place here after it has been ligated and cut. Then it's sealed up, salt up, so that the egg will not be able to pass through to meet with the sperm. Yes, let's look at the vasectomy. Vasectomy, that's a male sterilization procedure, and what happened in this is there's going to be ligation of fast difference tube. The fast difference tube are going to be ligated. Faster and easier recovery than a tubal ligation. The failure rate is equal to 0.1%. Is more effective than female sterilization. So in vasectomy, it talks about the male sterilization, just as it is in tubal ligation. There is ligation of fast difference. Instead of the fallopian tube in female, it is the ligation of the fast different tube. And we said that recovery rates for fast different and for vasectomy is very, very easy for the patient to recover faster than that of tubal ligation. And the failure rate is 0.1%. and this is more effective than female sterilization, than tubal ligation. So during vasectomy, the first difference is cut, or the first difference are cut. A urologist cuts and ligates, tie off the ducts. Difference: the sperm are still produced but cannot exit the body. The sperm eventually deteriorates and are phagocytized. A man is sterile, but because testosterone is still produced, he retains his sex drive and secondary sex characteristics. So in vasectomy, the man is still, can still perform, but the sperm cannot be released because the sperm is blocked. The sperm is blocked. So look at the first difference here: ligated, and this is what it is before, and this is what it will be after the vasectomy. So we have method based on information. They include withdrawal method, natural family planning, fertility awareness method, and abstinence. So when we talk of withdrawal method, means that the individual man who is having sexual intercourse with a woman will withdraw or remove the penis when the individual is about to ejaculate, so as not to ejaculate to the vagina of the patient, of the person is having the sexual intercourse with. Then we have natural family planning. These are the natural methods that people use. So we have fertility awareness method. So this fertility awareness method is when you look at and you are able to study, in the natural, you study the ovulation period of that person. Then the let's just look at it briefly because we have it here because for our time. Natural family planning, the fertility awareness method. Let's look at it briefly. Women takes a class on the menstrual cycles to calculate more fertile time. Then the natural family planning, abstinence from sex during calculated fertile time. So FAM must, that is the fertility awareness method, uses barrier method during fertile time. Perfect effectiveness rate is 91%. Typical effectiveness rate is 75%. No 100% safe day in irregular periods person. So what we are saying here is that in natural family plannings and fertility awareness method, we said that women takes a class on menstrual cycle. You have to get know better about menstrual cycle, and the person will abstain from sex during calculated fertile time. And then for fertility awareness method, the person uses barrier method during fertile time. The perfect effectiveness rates of this method is 91%, but the typical effectiveness rate is 75%. And then we said that there's no 100% safe day when the period is not regular. So we have come to the end of these studies. Just as I used to say, tell you, read all these PowerPoints, listen to the audio voice, and then very soon we are going to work on the interactive moments where we ask our questions. I still remain Dr. Awoleye, Dr. David Olusegun Awoleye. Thank you very much. Good luck.